All right, everybody, let's talk about tick safety for the summer. Let's talk about Lyme disease. Now, in 2023, there were more than 2,500 cases of Lyme disease reported in the country. Keep that in mind as we join Justin Wood, who is the CEO of Geneticks, Ticks is how you spell that one, a private tick testing company, as well as a staff scientist at the Magnotta Lyme Disease Research Laboratory at the University of Guelph. Justin, welcome to the program.
Thank you very much. I appreciate that.
You know, Justin, I'm going to start off this segment with a story for you. And I don't know if you've heard of this story yet. It came out this week from Drummondville, Quebec. I've only seen coverage in the French media. And boy, was it an eye-opener. So this woman in Drummondville, Quebec, this week, we found out just 2 days ago, 30 years old. She got Lyme disease at age 22. After 8 years of suffering, she resorted to medical assistance in dying to end her life after being unable to find the help that she needed to deal with her disease. She was down to 59 pounds and could only eat bananas, the only thing her system could take, right? So after 8 years of suffering with Lyme, she took her life. I saw that story and I said, my goodness, you know, what a terrible disease if this is what can happen with it. So Justin, let's first things first, you know Lyme disease here. Tell our listeners about Lyme disease, the severity here, what we're talking about.
Yeah, unfortunately, that story doesn't surprise me at all. The suffering that people endure with Lyme disease is, I think, something that your average sort of healthy person doesn't really have the capacity to understand. And I think that's really illustrated in that really tragic story that you just told. But this is the kind of thing that those of us that are involved in Lyme disease research and advocacy and, may have experience with it ourselves. We hear a lot of stories like this. We've seen a lot of things like this. The suffering is almost unimaginable. The sort of breadth of symptoms that somebody can experience, just based off of this one disease is mind-blowing. It's such a difficult disease to watch people struggle with. It's just so severe, really, really challenging. It's, like I said, it's not really a surprise to hear that story, though it's absolutely heartbreaking to hear it.
And of course, a tick-borne disease, right? And we're headed out into the woods, going hiking and that. So let's talk about that, protecting yourself and just how seriously we need to take it when we're going out to the great outdoors over the summer.
Yeah, absolutely. I think, again, kind of based off that story that you told, we do need to take it very seriously. So ticks, particularly in Canada, they're on the rise. And because of that, that means humans encountering ticks is on the rise, and because of that, incidence of Lyme disease is increasing as well. And Lyme disease isn't the only tick-borne disease that we have to worry about here in Canada, so I think we need to be really vigilant. There's a lot of things we can do to stay safe in the outdoors in regards to ticks, but I think that the most important thing is that we start to spread awareness about tick-borne diseases so that when people do encounter ticks or when they're in tick environments, they can take the right precautions, they can be aware of the right next steps if they do get bit, and they can be confident that they do need to take those steps rather than get a tick bite and kind of brush it off as, oh, this is nothing really to worry about.
So let's talk about the precautions here. What are the precautions you now advise across the country when it comes to protecting yourself?
Yeah, absolutely. I think the first thing is when you're going out into the outdoors to be aware of where you should and shouldn't go. So there's some areas that ticks are more likely to be. They can be found almost anywhere, but if you're hiking, it's best to stay sort of on the trails if you can. As you start to get off the trails, you're more likely to actually encounter ticks and get bit. And the clothing we wear can make a big difference as well. So we generally recommend people wear light-colored clothing to cover as much skin as possible. And this means that if you're out there and ticks get on you, it's going to take them longer to find your skin where they can bite you. And because ticks are dark, you'll more likely see them on light-colored clothing, and you can remove them before they bite you. It's always a really good idea to wear insect repellents. And with ticks, the best ones are ones that contain a chemical called icaridin or picaridin, and those are quite effective at keeping ticks off. So light-colored clothing, wearing those bug sprays that will keep the ticks away. And then doing what we call tick checks, quite consistently when you're out there and when you come home. And these are just, checking yourself over quite thoroughly if you can to see if any ticks are on your body, if they started to bite. And if they have, if they are on your body, you can hopefully remove them before they bite. And if they have already bitten you, then you can remove them properly to try to decrease the chance of them transmitting any of the diseases they're carrying.
Let me just ask you, shorts and T-shirts. For you, like knowing what you know, is that completely out in your attire when you go on a hike, let's say?
I wouldn't recommend people do it, but I also understand that, you're in the summer and it can be quite hot. So if you are going to wear shorts and a T-shirt, then you really have to be very, very thorough with your tick checks. You should be doing them, in my opinion, every 15 minutes or so. And you should be checking places that, the ticks kind of like to get to. And those are places like they like sort of warm vascular areas of the body. So the backs of the knees, around the hairline and the scalp, armpits, groin, those sorts of places. So I wouldn't tell anybody you can't wear shorts and a T-shirt because I understand it's summer and, people want to be out there and stay warm or stay cool. I would say that it's best to wear longer clothing. And that if you're not wearing that longer clothing, then definitely be more vigilant with your tick checks.
Justin, I'm telling you, as you're going through that, I'm in a radio studio. I'm checking myself for ticks. I'm touching all those parts that you mentioned. Justin, let's say you're on that hike or you get home from the hike and you notice you have been bit. What do you do?
Yeah, the first thing is not to panic, and I think that's what most people will do. If you look down, you see a little tiny arachnid embedded in your skin. It's kind of off-putting and a little bit terrifying. So the first thing is to not panic, because if we panic, then we won't take the correct next steps to safely remove that tick, and that's quite an important thing. So once you've kind of established some calm, the best thing is to remove the tick safely, and the way we recommend to do that is to use a pair of fine-tipped tweezers and to grasp the tick very close to the skin, as close as you can as possible, so that you're not squeezing the tick's body when you go to remove it. And then once you've grasped it there, you want to pull sort of gently but firmly directly up and out of the skin. And the tick, when it embeds, actually gets quite stuck in there. So you'll have to use quite a bit of pressure to pull it up and out. And you want to make sure that you're pulling directly up and out, because some of the mouth parts of the tick are embedded in the body, and we don't want to break those off and leave them in the body.
Mm. And then does that tick need to get tested after that happens?
So we recommend that, and that's maybe some bias because that's part of what we do. But the reason we do it is because when people are bitten by ticks, it's very difficult to determine if any pathogens have been transmitted to them that can cause diseases. And with tick-borne diseases, it's important to treat them very early. So with a lot of the traditional methods to determine if somebody's been infected with something like Lyme disease, it takes a minimum of 6 to 8 weeks for the test to even be viable. And then in a lot of cases, it's not particularly sensitive, so you may slip through the cracks of this testing. So we consider it quite important, because if you do test the tick, then you can determine what the tick was carrying. And then you can sort of say, okay, this tick that I was bitten by, it's carrying the pathogen that causes Lyme disease. I should probably follow up with, certain interventions with my physician or my healthcare provider. Uh-huh. Whereas if you test a tick and you can say, okay, well, this tick has none of these pathogens, then maybe you might take a different route with your healthcare provider. So testing the tick helps provide more information that can inform decision-making with the healthcare provider about what the next steps are after you've been bitten by a tick.
Justin, we have to leave it there. A lot of great information, by the way. I want to thank you so much for coming on.
Oh, no problem. My pleasure.
Justin Wood, CEO of Geneticks, and ticks in that Geneticks spelled Ticks.